Welcome to Chapter 8, Physical Distribution, the engine room of the pharmaceutical supply chain. Today, we'll explore how strategic decisions in logistics can transform your distribution network from a cost center into a competitive advantage. Physical distribution encompasses all activities required to move finished pharmaceutical products from manufacturing plants to the final point of sale. It's a complex interplay of transportation, warehousing, and inventory management. Every decision in physical distribution involves balancing three fundamental pillars: cost, service level, and capital investment. This strategic triangle framework guides all executive decisions. Cost includes transportation expenses, warehousing operations, and critically important inventory carrying costs, which can represent 15 to 25% of inventory value annually. Service level measures distribution effectiveness through key metrics: order fill rate, order cycle time, and on-time delivery percentage, all critical for customer satisfaction. Capital represents funds invested in logistics infrastructure, primarily inventory value, but also warehouses and vehicles. This working capital could otherwise fund R&D or marketing initiatives. These three pillars exist in constant tension. Improving service levels typically increases costs. Reducing inventory capital may require more frequent expensive shipments. Higher inventory investment generally improves service levels. Consider this scenario. Frequent stockouts of a key antibiotic in a high-growth territory. Executives face three options: use premium freight to improve service but increase costs, increase safety stock to improve service but tie up capital, or maintain status quo and accept lower service levels. Transportation typically accounts for 40 to 50% of total logistics costs. The three primary modes each offer distinct advantages. Road transport provides flexibility, air freight offers speed, and rail transport delivers cost-effectiveness for bulk shipments. Mode selection involves direct trade-offs between speed and cost. Low-cost, high-volume products suit road transport, while high-value temperature-sensitive biologics may require air freight speed and reliability. Modern transportation management systems use GPS tracking and route optimization to create efficiency. In India, GST implementation has reduced average transit times by 20% by eliminating state border checkpoints. Warehouse network design involves three main types: central distribution centers near manufacturing plants, regional distribution centers serving multi-state areas, and state-level C and FAs serving local distributors. Centralized networks minimize inventory capital through risk pooling but increase delivery times. Decentralized networks provide faster service but require more capital and higher operating costs. Post-GST, companies have consolidated from 25 small C and FAs to 5 large regional distribution centers, achieving better service at lower total cost through network optimization. Inventory management involves three types: cycle stock for normal demand, safety stock as a buffer against variability, and in-transit inventory currently being transported between locations. Safety stock levels should be set scientifically using ABC analysis. High-margin, fast-moving A-class products receive higher service level targets and correspondingly higher safety stock levels. Warehouse management systems ensure accurate tracking and enforce first expiry, first out processes. Barcoding and RFID technology provide essential batch-level traceability for regulatory compliance. India's pharmaceutical distribution is being rapidly transformed by the rise of quick commerce and B2B e-commerce platforms. Quick commerce apps like Pharmeasy, 1mg, and NetMeds now promise doorstep delivery of medicines and health essentials within hours, using hyperlocal warehouses and real-time inventory management. These platforms are bridging the last-mile gap, enabling rapid fulfillment and integrating with traditional supply chains to meet rising customer expectations in urban centers. Meanwhile, B2B e-commerce marketplaces like IndiaMart and Trade India connect pharmacies, hospitals, and distributors directly with manufacturers and wholesalers, streamlining procurement and increasing transparency. Digitalization brings opportunities for data-driven decision-making, real-time analytics, and improved regulatory compliance, but also presents challenges in product authenticity, cold chain management, and channel integration. As India's pharmaceutical market evolves, mastering the interplay between conventional distribution, quick commerce, and B2B e-commerce will be essential for building a resilient and customer-centric supply chain. Remember this critical insight. Inventory carrying costs represent 15 to 25% of inventory value annually. Reducing inventory by 1 crore rupees directly saves 15 to 25 lakhs annually. As future pharmaceutical executives, your role isn't managing day-to-day logistics operations, but designing systems that achieve optimal balance between cost, service, and capital for your specific business context. By making informed strategic decisions in transportation, warehousing, and inventory management, you can transform physical distribution from a simple cost center into a powerful engine driving customer satisfaction, market share, and profitability. This foundational framework prepares you for the specialized compliance and operational areas we'll explore in subsequent chapters. Master these concepts, and you'll be equipped to optimize the core logistics engine of pharmaceutical distribution.